Hello, my name is Anthony Zaki and I'm a heart surgeon at the Cleveland Clinic. Today we're going to talk about 5 cool facts regarding heart transplantation. The first cool fact regarding heart transplantation is that the first heart transplant took place in 1967. This was a famous surgeon by the name of Dr. Christian Barnard in South Africa. Now, Dr. Barnard came to the United States on a visit, learned about the procedure where much of the research was happening, and was able to go back to South Africa and do the first procedure in 1967. In Cleveland Clinic, the first heart transplant took place 1 year later in 1968. Now our heart transplant program officially began in 1984, and we are celebrating our 40th anniversary of our heart transplant program this year in 2024. Now to date, we have done more than 2,000 heart transplants here at the Cleveland Clinic. The second cool fact about heart transplantation is that a heart can be preserved outside of a body for up to 4 to 6 hours. Now the process is quite complex, but a donor is identified, our team goes and evaluates the organ, and once it's deemed to be suitable for transplantation, the heart is removed from the donor, as preserved, like I said, for up to 4 to 6 hours, and brought back to the Cleveland Clinic, where one of the heart transplant surgeons, like myself, will implant it in our recipient. The third fact is that we can transplant multiple organs at a time. So often people with heart failure who meet criteria for heart transplantation also have either kidney failure or renal failure or lung failure. So what we've been able to do successfully here at the Cleveland Clinic is not only transplant a heart, but at the same time either a lung, a kidney, or a liver. So we have one of the largest programs for multi-organ transplantation, and we frequently do combined organ transplants here at the Cleveland Clinic. The fourth interesting fact about heart transplantation is that a transplanted heart will beat faster than a normal one. That is because a lot of the nerve connections are not reconnected at time of a heart transplant. They're too small and hard to find. So how does a heart transplant beat if there's no nerve connections? And what's amazing about the heart is that the heart will beat on its own without any external stimulation. So a transplanted heart, even though the nerve connections are not redone, will beat on its own regardless of any external input. The fifth and last interesting fact about heart transplantation is that many patients can live more than 20 or even 30 years after their heart transplant procedure. Here at the Cleveland Clinic, at 1 year, more than 90 to 95% of our patients are alive and doing well. Now, life after a heart transplant requires a dedicated team to follow you to manage your immunosuppression and other medications and procedures. But here at the Cleveland Clinic, with our dedicated team of cardiologists, surgeons, nurses, and coordinators, we take care of our patients and ensure a good outcome long term. So I want to thank you for tuning in on our 5 cool facts about heart transplantation. We look forward to meeting you soon.